I'm talking about when we talk about yearly well-woman test. So it might be interesting to some of you to know sort of how it goes here. The majority of my viewers here around my age group to about 65. So here at the local GP's office or the GP surgery here in the village. And if you have been following my channel now for the past couple weeks, or if you're new, I have some videos about the NHS sort of versus American healthcare, privatized healthcare. And one thing I make sure to disclaim is that I have not received healthcare in every U.S. state, at every U.S. hospital. I have not been a patient of every doctor in the U.S., so I can't speak to universally to how everything works. The same is true here. I have not been a patient in every trust. I have not been to every hospital. I can speak to my own personal experience, which is pretty extensive in terms of receiving medical care both in the U.S. and the U.K. Now that I've disclaimed that, I have 2 other videos about some differences between here and there. The last one I did, I was having my birth control implant that was in my right arm removed. And I'll put a link to that video in any event. So I had my PAP done. The difference here, when I lived in Arizona, my insurance paid for 1 well-woman check a year. And so you would have a breast exam, a pelvic exam, a pap smear, and if you wanted, you could have a full STD panel. Here, that's not offered. So you get a pap every 3 years, screening only for cervical cancer. You don't get STD testing automatically, as far as I'm aware. They do not do a breast exam, they do not do a pelvic exam, they do not do any feeling of the uterus. You see a sister or a nurse. So basically, I went in, got called right away. Hi there.
Just wonder what you're doing.
So there's no checking the tatas, there's no checking the uterus, there's none of that. So, and you only get it every 3 years. I imagine if you paid for private care, you might get more frequent tests, or you might be able to request other tests, or if you went to a sexual health clinic. I don't even know where there is one around here. That's just a little taste of the difference. I know there was a young woman who died, I think in her early 20s, of cervical cancer, and before she died, she had been asking for better and more frequent screening because younger women can indeed succumb to cervical cancer. It's not just women in their 30s, 40s, 50s, etc. Unfortunately, she lost her battle with cancer. And here we are. Still, the NHS feels it's only necessary after a certain age to do it every 3 years. I don't agree, but I also do enjoy having free healthcare. So, I mean, it's not 100% free because we do pay tax, which funds the NHS, but I do appreciate having healthcare. So you've got your pros and your cons. Anyhow, that's all I've got to say, and here's my taxi. We'll see you later. Bye-bye. Hi there.
Just wonder what you're doing.
I have a video diary, so I keep a video diary.
On YouTube?
Yes.
Alright. You sip something on your boot there, by the way.
Oh, it's supposed to be. There's a zip over here, so it's decorative.
I like your YouTube videos.
Oh yes, me too. Yeah, I do videos for my family back in America.
Oh, do you?
Yeah.
I know YouTube for police harassment.
Oh no.
You know what police harassment? TV licensing goons.
Oh.
Phone calls to the council and stuff like that.
Oh yeah.
I always say to them, they say these calls get recorded and monitored, so I said to them, well, at the end, you'll be on YouTube later.
right, exactly.
Put
Yeah.
some people on YouTube. Yeah. Only people who come to me don't like TV licensing goons.
Oh yeah.
You don't have to have a TV license, do you, this day and age?
Yeah, it's so silly, but
You shouldn't have to have one.
yeah, we don't in America.
Yeah.
We don't.
You?
No, we don't. Like, here, let me turn this off.
Where about do you work?